Treatment at Aromo Health Center 3 on Wednesday at around 10 p.m. was brought down to a standstill when the heavily accumulated bad feces forced down the ceiling board for the maternity ward while a mother was being worked on.
As I moved out to pick the patient, doctor was already dressed. Mysteriously, we only heard a sound. I just walked some distance. The patient fell down as she heard of something coming down.
Beta Kelo, the midwife who was on duty, says when they heard the sound, they all took off and all the patients took refuge under the beds.
If she had not fallen down, the whole ceiling board was just coming on her.
This prompted the authorities to immediately discharge all the patients from the facility to the nearby health center, including Gur Health Center 4, Lira, and other private clinics.
Now we are not on a good condition because most of the women who are now coming to the health center, they have been referred to other private clinics.
However, even when the facility is still inaccessible, Akelo says mothers still flock the facility for better management, but they have nowhere to put them.
My work is so painful. If I see a mother and a baby dying, even me, I feel like it is me who has caused the death. But since now, there's nowhere for me to work. I've been here even over the weekend, receiving those ones who are coming and directing them where to go because I can't assist them.
One day, Picky, Apola. It's in the Ramkan. Naturally, copy fancy. Pay word, OPT word. One natural community management, Maron Center City. Uberu Ping, Carberu Ping, Teacher report actually. Subcon.
We have put in our budget for this financial year to rectify it, to renovate that ceiling board. We have put the budget of 15 million. But we don't know because it is under local revenue. We are not collecting local revenue from the businessmen. We don't know what may happen.
David Illich, the chairman LC3 of Aromo sub-county, said the only building they would resort to this time of emergency was the general ward, which ceiling also collapsed last year even before its handover.
In 2017, we put in our budget renovation of main ward worth 16 million. The district gave out the contract, but as you can witness from there, it was incomplete and the work was pseudo. As I talk now, we don't have anywhere to admit the patient in case of an emergency at the health center Aromo.
What becomes now the fate of the vulnerable community of Aromo without a serving health center and the current situation of COVID-19 that has sent many dying in poverty and issues surrounding transport since borders have been banned from carrying people and the public vehicle is extremely expensive.
We are going to receive a lot of cases of death of women and the death of children who are being born in the hand of traditional birth attendants.
This is the Northern Wrap on Amuka TV. Subscribe to our YouTube channel and follow us on social media for more stories. We are driven by a desire for an informed community.